Now, the Western Cape has the highest number of both COVID-19 infections and deaths. Unfortunately, the province has passed Gauteng with 1,413 infections and also 30 deaths. I'm joined by Eric Kweleta from the National Education and Health and Allied Workers Union's Western Cape Secretary. He chats to us more on the impact that this has actually had on the provincial healthcare system. Mr. Kweleta, thank you so much for joining us this morning. First of all, let's just talk about the fact that the cases in the Western Cape are rising, and from a Nehawu perspective, one of your biggest gripes has been the lack of PPE, protective equipment for some of your members. What's the position now in the Western Cape?
Good morning. Yeah, look, Nehawu's position hasn't changed. It's very much worrisome for us that now Western Cape has become the epicenter. As you will know, we were the first ones to approach. We wrote a letter to the Premier and the MEC as early as the 3rd of April, where we've highlighted the challenges within the workplaces in relation to these PPEs and what it will lead to. Up till now, no one has yet returned to us, and it's seriously worrying. To date, we've got no less than 60 healthcare workers that are already been infected with the virus.
Now, the head of the province's health department, Mr. Dr. Keith Klutter, he says that in terms of equipment, the province has 2 million surgical masks with 1 million on order, 4,000 personal protective equipment, and he goes on to say a further 50,000 gowns also on order. Have you been in contact with the department itself, because they seem to be doing something about it at the present moment?
Yeah, look, we must acknowledge that indeed something is happening, but we will just want to invite the media to maybe take a walkabout with us, because we interact daily with these members in these institutions, and we are at present, when we see how they are exposed to these conditions. For us, if you say there's sufficient PPEs, why then do you give health workers 4 masks to use for the entire month, meaning 1 mask we must use it for the entire week, which then exposes yourself to a very serious health risk of contracting the virus.
Now, when you look at the Western Cape healthcare workers testing positive of COVID-19, doctors 8, 3 in the public and 5 in the private sector. We've seen in the private sector as well in KZN, many of the healthcare workers also testing positive. What's going on in the private sector? Have you been in touch with some of the hospital groups in the private sector?
Yeah, we must tell you what you've seen in KZN is a common trend in the Western Cape, but the challenge we're having there, the employees are scared of voicing their concerns. We've had numerous anonymous calls where the workers, in fact, are being forced not to say anything, not to really highlight what the challenges are. So that particular sector is a ticking time bomb. Sooner or later, all of us will be there to tell the story.
What recourse do you have if your concerns are not heard in the long term?
Yeah, look, ours would have been to really have a sober engagement at the level of the MEC and also at the level of the Premier, because here we understand that we cannot be engaging from 2 opposite sides, because this is something that affects not only Nehawu workers, and we don't see them as an employer, but this is something that affects everyone in communities, in the workplace. So we think that a sober engagement and a common approach can really assist as to where we can go and do more in terms of averting more infections to take place, in particular in the communities. You've seen in the past week how there's been an increase and the lockdown has not really been observed in the poor working class communities. And those healthcare workers that are sent there to go and perform the test have not been subjected to trainings, because you just go through a councillor's office and ask for volunteers to come and do the test and screenings, which means we are indeed still going on an upward trajectory in terms of these infections.
All right, thank you for speaking with us. That's Mr. Eric Kweleta, who's the Provincial Secretary of Nehawu in the Western Cape. As of the 21st, we've had at least 13 nurses or 16 nurses who've been infected by the COVID-19 virus in the Western Cape, 4 public and 12 from the private sector. It's all about the PPE.